I call it, and I've heard this before. They call it fear porn. It's fear porn. He
was quoted about $45,000 for all-on-4 top and bottom, and it was not zirconia. It was like
acrylic.
It was acrylic.
Wow!
It was
acrylic.
$45,000.
And now Turkey is in the game.
Oh yeah.
And we've been seeing a lot of crazy X-rays from Turkey.
Well, we've been seeing a lot of it because, first of all,
weird X-rays.
Yeah. Oh God.
How long is my warranty? Well, we'll tell you when you come in. What?
I don't have it.
I'm driving a Chevrolet. I'm sorry, bro.
I'm sorry for you.
Oh. Hey, can we cut him out of the podcast, please? And we only want to help the people that really value all the affiliations, accreditations that we have and all the hard work, because when you're here, it's all about you. Welcome back to Supreme Dental Podcast Studio.
Estos son podcasts, no chingaderas.
You can be anywhere else in the world right now, but you're here with us.
The level of mastery you have on dental work is extraordinary.
Do your research. Perfect.
This is the podcast.
Hello, welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you. My wife and I are the owners of Supreme Dental Clinic. We're on Spotify. We're on Apple Podcasts. And hopefully soon, you'll be here with us. Today we have Jessica. How you doing, Jessica?
Good.
All the way from Indiana.
Hello.
And we have the fan favorite. We have Dr. Luis. How you doing, Luis?
Hello, I am good. I am okay. Hello, everybody.
Hello, everybody. That should be the brand. Should be some merch.
Yeah.
Hello, someone.
Hello, someone.
So we made some differences here at the podcast. Making everything a little bit more comfortable.
It looks great.
Making sure that
very different.
More
comfortable.
My feet touch the floor.
Oh yeah,
that's a plus.
Good. That's good.
That's a plus.
These chairs are very comfy.
They're lazy boys.
Yeah,
they're
nice.
Lazy boys. So we want to talk about several things. Actually, you want to talk about several. So why don't you guide this conversation?
Oh my goodness.
What do you want to talk about? Because you are in the trenches. You speak to all of our patients.
Every day. I talk to lots of patients from across the country, all the way from Vermont down to Florida, Atlanta, California. And one of the things that I found, and even in the last, I would say at least 48 hours or so from the patients that I've talked to just recently, 3 in a row, boom, boom, boom. The most common thing that they said, the first things that came out of their mouth was, I have dental trauma. And these are people that are calling us from the United States. And, everybody's story was a little different and everything, but the common thing was the dental trauma was in the early years or in childhood. Scary stuff like pulling teeth with no local anesthesia, or getting wires taken out of their gums after having an accident, and no Novocaine. Wow. It was scary stuff that I've been hearing the last few days, and I was like, this is a very common theme and something that probably would a lot of people would relate to, and I think that our team is a very compassionate team that once somebody that has experienced something like that, I think could probably come out of that eventually, or at least feel a little different about the dentist, So, scary stuff, and I feel for them. I felt bad for the people that I was talking to, because I could tell that in their voice they were even scared. I'm like, I'm not the dentist, you're not in the chair with me, but they were already scared about it.
What do you have to say about that, Luis? How many patients have you had that are scared of being at the dentist before you treat them?
Honestly, most of the time we have a patient with a bad experience with another dentist. It's very important to us to understand the history of the patient. That's why the conversation is good in the beginning, to check any trauma, to understand the situation. Sometimes we can start very, very slow. Sometimes we can do the process quick. It's easy, but most of the time it's very important to start slow, step by step. Maybe sometimes after 30 minutes, we can continue with more faster the process, but depend of the patient. But it's very, very important for us to understand the history, the trauma, any trauma or something. That information can help us.
I've talked to you before that we believe that sometimes a patient comes in and yes, they need some dental work or they need, for self-esteem or even to just be able to eat. But a lot of times they need someone to talk to. They need I'm not going to say a psychologist, but they need somebody there. And they start telling you guys all the problems they had before. We've had a patient that we thought that her husband would beat her. Remember? I would think it was Dr. Elias.
Yeah.
And we were like, man, what? It's the dental trauma. I think connects to other things that was going on in that patient's life at the time, perhaps. And it's just something that even the sound of the zzz, the drill, it's just some patients like I can't stand it. And then sometimes I seen when you like you just said, 30 minutes, 40 minutes talking to the patients so they can warm up to you and they could be like, okay, because they want to get it done, but it's just something that's not letting them get it done. Now, do you guys feel, for example, we are in Mexico and we are the underdogs sometimes when it comes to medical procedures. So do you feel that our patients, being a big percentage of our patients being from the United States, do you believe that fear it's put on from doctors in the United States, or do you think who do you think is bringing up these? Because most of these people that had dental trauma was in the United States. So you're in a whole different country now, and do you think that perhaps the dentists over there are making it worse? I mean, not every dentist, but what do you guys believe? What do you guys think?
I think it's the system. The system in United States is very different than Mexico. For example, in United States, are working with insurance. I'm sorry. Yes. Sometimes the fear factor is very, very important to avoid, for example, the IV sedation. Sometimes the IV sedation is the best option for them, but sometimes the insurance is not, that procedure is not included.
Doesn't cover it.
Yeah,
They don't
not
cover it.
Yeah, and it's a problem. Okay, because with the IV we can to prevent any trauma. Yeah, you told me in a moment one experience with a patient, with one patient.
Yeah, the gentleman I was talking about that he hadn't seen a dentist since 1979.
Yeah.
And
I was born in 1986.
Yeah, so before
You were born what, like 2000?
And 91.
he hasn't seen a dentist before I was born too.
Wow.
So
Well, just gotta throw it out there.
Yeah.
so I wasn't born yet, but that was the last time he had seen a dentist. He had he was a young guy then, had gone into a fight, and he kind of lost, but they broke his jaw, so they had to wire his jaw shut. And when it came time to remove the wires, his insurance wasn't going to cover the Novocaine, and they wouldn't let him pay out of pocket.
I thought you were gonna start singing Kanye West right now.
Oh,
Through the wire.
Through the wire, yeah.
It sounds like Kanye West right now.
I know, right? Well, he had similar situation where
Oh,
he had a broken jaw or something like that. I don't remember.
in an accident, yeah.
Yeah. Well, they had nurses holding down his arms and holding down
My
his
God.
legs, and they took the wire out of his gums that had grown over without any anesthesia. And he said, and ever since then, I have not been there. He said, but I'm tired of being in pain. I'm tired of he goes, these teeth are hurting me now more because I can't eat. He's malnourished and all of these things. So, I mean, the problem then it's a snowball effect, right? Because now he's in a place where he can't eat properly. It hurts constantly. The pain never goes away. So, hopefully we'll be welcoming him here in the next few weeks. But that was a conversation I had just the other day. And I felt bad for him. I was like, oh my gosh, I go, come here and see us. And and of course I took the time to tell him, I'm sorry you went through that. And our doctors are the most kind and compassionate doctors that I've ever, that's all I know is Supreme, right? As far as that goes. But, I've been here for 6 years and I've never had a patient come out and say, you guys made things worse. In fact, it's the other way around. They come out and they're like, they're so kind and they're so gentle and they explain everything.
I think it has to do a lot with, I call it, and I've heard this before, they call it fear porn. It's fear porn. It's some patients get addicted to fear in a way.
Yeah.
So some doctors, there's good doctors and there's bad doctors everywhere. Everybody knows that. But there's doctors in different areas where they say, you're gonna get done in Mexico. Oh, be careful. I heard the horror stories.
Yeah.
So then automatically, those patients come scared, and it's not just they're scared of the country, right, that they're going to. I believe that the fear should come in not of the country, it should come in on the dentist that you choose to go with,
right?
The dental clinic. So there's going to be great dental clinics anywhere. There's going to be bad dental clinics anywhere. That's why you do your research. You do your research to say, hey, I picked this clinic because of this. I picked this clinic based off of this. I called them. I asked them questions. I seen online. I seen reviews. I've seen podcasts, whatever it is, videos. Mm-hmm. You got to not be on that fear bracket. And yeah, I think because of insurance, a lot of places are like, well, we're going to do this time.
Yeah.
And then next year we're going to go ahead and do this part. And they know that the best thing to do is everything, because if not, it's just, you can't put you can't put a stiletto, you can't put a high heel on your right foot and a tennis shoe on your left foot for 6 months until you can buy the other one on this foot, because then you're going to be walking like this.
Right.
But then if you cut the high heel here to match the shoe here, you're not really changing anything. Mm-hmm. So it's not fixing. You're patching the situation, which we have here all the time. That patients come in, I spend thousands of dollars in my mouth, and it's all patched. A little bit of fillings here, crowns over here, older crowns over there. They're not sealing here, but they want an implant, but there's not enough space.
Yeah.
Mm-hmm.
We see that on the daily, but to me, is that fear porn is making somebody be scared. Right now, the world, everybody's like, oh man, we're scared of going to war. And Ukraine and Russia are in war. Iran in Israel, the tariffs, Trump, the economy,
It's just a bunch of
the inflation.
fear-mongering.
If we talk about that fear, we'll find fear anywhere, But that really has nothing to do with your experience that happened 30 years ago, 25 years ago. It's about just feel comfortable, ask questions, no matter where you go. If you come here, if you come here to Supreme Dental, if you go to New York, if you go to Atlanta, if you go to Dubai, if you go to anywhere, Turkey, anywhere in the world, do your research, ask questions. And if they don't want to answer your questions, because there's a lot of shady clinics, as we know in this room, that don't want to answer certain questions. How long is my warranty? Well, we'll tell you when you come in. What? What do you mean? Just imagine if you're going to buy a car. You guys go to the dealership. You're going to buy a brand new Mercedes or Lexus. You have a Lexus, right?
No.
What do you have?
BMW.
I'm sorry. I'm sorry.
I don't have a Lexus.
I'm driving a Chevrolet. I'm sorry, bro.
I'm sorry for you.
Oh. Hey, can we cut him out of the podcast, please?
Hey.
He's my boss.
Be nice.
Anyways.
It's so fun.
So you got a BMW. Yeah. Just imagine you call the dealership.
It's an old car, but
it's like 2023. It's old.
It's
2024.
old.
It's old. So let's say you call BMW. You're buying a brand new car, right?
Right. Yeah.
You're calling them up. You want tell me I don't know much about BMW. Tell me a car BMW. What's a good series?
Ford? I don't know. Or no. Jaguar?
No. What's a good series on BMW?
I got it. X1.
X1. So you're going to buy an X1 2026. And you ask for the warranty. What's the warranty on the engine? And they go, hey man, just come in. We'll talk about it. What? Why can't you just tell me my warranty? 50,000 miles, 75,000 miles, 35,000 miles, or 5 years, whatever comes first, and then I have to buy an extended one. That has to be transparent. You know, that's basic stuff. If I'm calling over and I'm telling you, hey, I want to get an all-on-4, zirconia, what's the warranty? Hey man, just come in and we'll talk about it. No,
Yeah.
don't go
No.
in. Just tell me what the warranty is. 3 years, 5 years, 10 years. What do you got? Then it's on me to make my decision and do what I got to do. But there's clinics, when I'm talking about fear porn, is you should have more fear about the clinic you're going to than actually the country you're going to. Because if you make a wrong mistake of where you're going, don't matter where you go, it's going to be bad.
It's going to cost more to undo what they did.
It's going to cost a lot more because now we got less choices to make. So more important than being scared of Mexico, be scared of the clinic that you choose to go for. Do your research.
Yeah.
Do your due diligence. Everybody that we treat for big procedures is over 18, which means everybody's an adult. Everybody has the authority to be able to ask questions.
Well, and access to information. And I mean, everything that we tell them over, everything that I'm explaining to the patients as I talk to them on the phone and everything, it's not anything that I'm just like pulling out of the air.
Everything should be online to
Everything,
start with.
they can look it up. They can find the person that I talked about that I'm like, hey, and actually the things that we talk about, I send them links to the video, the links to all the things and everything. So I mean,
let me ask you guys a question. You're going to get surgeries on your knee. Your knee hurts. But here in Mexico, or you're in the United States, but here in the United States, it's $100,000. But you need it because your knees hurt and you can't walk. You got to work. And they have it at, I don't know, whatever country. China. And it's going to be cheaper, but they're going to do great work, right? So you're going to want to do some research on where you're going to go.
Right.
So if you call somewhere and they tell you, what kind of materials you guys have, I don't
know. Yeah. He's from China.
Just come in. Yeah, you're thinking, well, it's going to be China, it's going to be cheap.
Yeah, it makes
made in Taiwan.
Taiwan, imagine that.
But I'm pretty sure there's great dentists over there too. So it's I think it's the peace of mind of where you're going to go. You as a patient, you got to understand that it's a procedure that you don't want to pay for or you cannot pay for where you're from. Mm-hmm. And you want to go somewhere where you know they could get the work done.
Yeah.
And not just getting the work done, is that the implications or complications that might happen, they'll be able to handle them.
Well, and I just talked to a guy, again, it was part of my trauma series. It was like boom, 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 like I have trauma. I'm like, okay, this is a thing right now. This is this is very present. But he was quoted, where did he call me from? He's like in the Big Bear area or something like that. So we're talking California.
Beautiful place.
Beautiful
Big Bear, California.
Yeah.
Very expensive for dental, apparently. And so he was quoted about $45,000 for all-on-4 top and bottom.
Wow.
And it was not zirconia. It was like
It's acrylic?
it was acrylic.
Wow.
Metal
It was-
acrylic.
it
was-
They're doing
yeah.
metal acrylic.
$45,000.
Imagine with zirconium.
Yeah, imagine.
More expensive?
So we're probably talking maybe like 60.
Imagine with Strawman.
No.
75.
Boom, boom,
100.
Yeah,
Maybe.
and he said, Jessica, he said, I have the money for it. He goes, I could pay for this right now. He said, but I have been doing research, and I was like, keyword research. Like whenever they say I did my research, and I'm like, yay! And he said, I've narrowed it down, and I'm talking to you because you seem to be one of the clinics that is in line with what I'm looking for. And we just talked and answered a few more questions and everything. But people that have the money don't want to pay that. And he even told me, he said the place where I went to doesn't have nearly as much. They don't have their own lab. They don't have the qualifications that you all have, the accreditations and all of that. He goes,
Yeah.
it's crazy. He said, I'm getting more for less. He goes, it almost feels it almost feels like I'm stealing,
Yeah.
and so, but it's almost a no brainer. Like,
Look,
yeah,
but look, I'm not. I don't want to get it wrong here. Just because a clinic doesn't have a lab, it does not mean that they're going to do bad work. That's not what we're getting at. We love to I love to control the controllables. So I know what we're putting out in our lab. I know what zirconia Aman Gierbach is putting out in her lab. I know the person. I know the machine that we have, which we had a lot of problems back in the day because what we were sending them to could not mill that direct.
Yeah, I remember that.
Remember that? So
A lot of problems with the connections. Yeah.
then we would manually have to go in there and change things
Yeah.
up. And once you do that, you know that it's not how it should be.
Another important thing is remember with the process for zirconium is for 9 hours sometimes, and we have the control for the time with the machines. With another lab, external lab, we don't know. We don't know
We just see what they look like, but we
Yeah.
don't know the megapascals.
for sure.
We don't know the strength. We don't know what zirconia they're using. They could say they're using Ivoclar
from
or
China
Aman-
or
they could be
Taiwan.
from anywhere.
Yeah,
And we don't know.
anywhere.
We don't know it, and there's no way to see it. But time will tell when things break. And you'd be like, well, I thought this was the best quality. And that's why for us to say that we are really good at what we do, it was something that needed to be added. So then we have that spot out. Because if you're the best dentist in the world, let's say you're the best dentist in the world, but the lab you're working with is mediocre.
You are not the best.
You're not the best.
Yeah.
Because then the thing's going to break back. And
Yeah.
when it breaks, what is the patient going to say? Dr. Luis.
Doctor, not the lab.
They're going to say the
Yeah.
lab.
Yeah.
Yes, it was Dr. Luis.
It's my responsibility.
It's your responsibility. And you had nothing to do with it. You did all your work perfect.
you have to
Yeah.
give face for it.
You know, and you gotta represent. You know, it's your hands that worked on that patient. Here we're blessed to have doctors that's from start to finish. It's the same doctor.
Yeah.
You start the process. Your vision,
I have the vision.
your vision of what is gonna happen, especially when you do implants. You place the implants. You know, when you come back, you're gonna have to do the prosthesis. You know that it has to make sense because some doctors just put the implants. Then the other people are the prosthodontists, and they have to figure it out.
Yeah.
And then they're like, why the heck would you put the implants like this? It's better to just
How is the
stick-
process? Yeah.
What was the vision?
What is the vision? Yeah.
What is the vision? One thing that I wanted to talk about before we leave is you've been getting a lot of our representatives or coordinators have been getting a lot of pictures from work done in specific country.
Oh yeah.
And this specific country is known for hair implants, but it was never known for dental.
Right.
And now Turkey is in the game.
Oh yeah.
And we've been seeing a lot of crazy x-rays from Turkey.
Well, and we've been seeing a lot of it because, first of all,
We are X-rays.
yeah. Oh God, the pricing is very enticing.
Very, very,
It's very enticing. It's
very competitive.
very competitive. We're talking to patients because they're already trying to not pay U.S. prices,
Right.
Right, and so we come in. Hands down, we come in lower than 85-90% of what doctors are quoting in the U.S., but the prices are, I think, freakishly low in Turkey, and I'm just like I'm like, hey guys, listen, I know that you're looking for a good deal. I love a good deal, but this is scary.
Yeah.
How low it is.
Well, let's ask the baller Luis over here with his BMW. If you get a BMW X1, what's the price kind of on a BMW X1?
New?
New.
50,000.
$50,000.
$50,000. Yeah.
Okay. 50. You want to loan him $50,000 days? I think he has it in his left pocket or something. 50,000. So $50,000.
$50,000, yeah.
What if I told you that if you go to Turkey, that car is $15,000?
I don't know. What is the car? I don't know.
$15,000.
Same
This
car.
BMW.
No,
15,000.
Nah, it's fake. Yeah.
There's
I'm
no
sure.
way.
I am sure.
You start doubting
Because
a car.
the price is... It changed depend of the country, but
How-
it changed a little bit.
How come they don't? How come patients don't doubt dental? You would doubt if I'm gonna go buy a Gucci purse
Yeah.
and it's $2,500, but some guy in the street is selling it to me for $300. Why would I think it's real?
It's a gookie.
It's a gucky.
It's a good copy.
It's a Fuji.
Yeah.
It's a Fuji.
It could, and you know what? There's nothing wrong with buying a replica. Hey, it's okay.
But
In medical,
explain that.
but in medical is a little bit different.
Yeah.
no, yeah.
You know, I mean, I don't know. It's just kind of like part of your body, you know? And if for any reason you get infections or for any reason something messes up and then you start saying, oh my God, I should have never trusted him. You should have done your research.
Yep.
You should have been more realistic. If it sounds too good to be true, it is.
I think that
Mostly is.
Turkey is what Mexico is to Europe, United Kingdom area. You're closer to, I know that it's very common for people from Europe, United Kingdom, London, England, or whatever, to go to Turkey for that kind of stuff, but it's in proximity, so you probably know more people that have gone there and stuff. Do I doubt that? I don't doubt that there's good doctors there, but that is a really hard research.
Well, they could be good doctors there, but are they good labs there?
Are there good labs there?
Labs.
Have
You know,
they done the type of training that our doctors have done?
How many years have they been in algodones? Is if we start doing implant hair, which I don't know if they do here,
No.
but if they do it here, it's not going to be as good as Turkey.
No.
Turkey's been doing it forever, and they're notorious for that. Algodones is notorious for dental.
Right.
For dental, yeah.
You know, it's kind of hard to compare a doctor that does an all-on-4 once a month to somebody has done 3 in a day.
So just yesterday, because I am on some Facebook groups where there's and I actually
She's a spy.
I am a spy.
She's a spy.
I'm a spy. I'm a stalker. But I rarely jump in on any of those. I just like to look just for research recon for research purposes. But there was a just last night. There was a guy that said, "I just got my implants done in Turkey," and he showed his X-ray. His X-rays had nothing but they were short implants, very short in the back, and then very short implants, and then
The position
they were
again.
straight. Yeah, they were straight, not or anything like that. And he had 6 on top, 6 on bottom. And then he said, and then he showed another picture, and he said, "This is my friend's X-ray, and mine. Why do mine not look anything like his?" His friend's X-ray. He actually did get them done. I don't know where he got them done. Could have been.
He got the gucky.
But his friend's X-rays were like what ours look like with the angles. He actually had pterygoids.
Very good.
It looked beautiful, and I did jump in on that one, and I said that is a great example of what a full arch is supposed to look like with the proper angulations and the proper placement of implants. But his was done in Turkey, and it was like just all over the place, uneven and everything. And I was like, ugh.
But for example, who is the parameter for us? Is the best doctor of the world? Dr.
Right.
Vanderlin, Dr. Sinada, Dr. Dan Holtzclaw
Mm-hmm.
is our parameter.
Right,
To we are learning of the best.
right.
That way is my number one.
Yeah.
We are doing or we are making the same procedure or a similar procedure than the best doctor of the world.
And that's who your standard is. That's who you look up to.
Yeah, it's,
for,
it's our standard.
Remember
yeah.
when back in the day, Luis, there was a lot of mini implants?
Oh yeah.
There was a fever here in Los Algodones.
That was
what we're talking
popular.
about, like 7 years ago, 5-6 years ago.
Yeah.
Everybody wanted to do mini implants.
Yeah, I remember that. Yeah, they are using a mini implant, but oh my gosh, now we can see the problems. Years later.
Time will tell.
Yeah.
So, I mean, being Turkey,
Yeah.
they should be following guidelines of the rest of the world, not of Turkey.
Yeah.
You know, the rest of the world that's been doing these procedures for many, many, many years and learn from that and go out there and learn. I mean, I'm pretty sure there's good clinics in Turkey. But so far, the work that I've seen has not been anything but stellar. You know, everything, I've seen some things that you're like, oh my gosh. So actually, we're going to start a little, what are we going to say, a docu-series?
a series, yeah.
We're going to start a series. I haven't told Days yet, but we're going to start a series about
Ask a dentist.
Ask a Dentist.
Yeah.
So I'm going to ask you, and you're going to see an X-ray, and you're going to tell me what you see and how you would do it different.
I think it's gonna be great.
And you're not going to know where the X-ray's from. And obviously, we're not going to pick no one here in Algodones because we don't want Days to get beat up in the streets. Again, I'm just kidding. So we want to do that. So we want you guys to see a case, take a look at it, and then see what you guys would change, why you would change it, and why that is right or why that is wrong. And all of our doctors are going to do it, including Dr. Dulce, which she's about veneers. She sees a lot of veneers that you can see the tooth underneath it on the gum line.
Oh, yeah.
That is no longer is not sealing, and it's brand new. The dental clinic is actually showing it as look what I got. If they're showing that, what are they not showing you? And yeah, so we're gonna go ahead and do that, and just put not just Turkey. I mean, put the world on blast. I mean, if you're doing things wrong, I don't care where you're from. You could be from across the street. You can be down the hall. You could be across the world. We're going to call you out because people should not be going through these things.
Right.
Our patients that come in are people, and a lot of them have saved up. A lot of them have sold things.
Oh, yeah.
A lot of them just want to get their life back. And then you have someone on the other side of the chair that goes to a course and starts doing zygomatics because he thinks he can, which he can't get an all-on-4 right. You're putting your faith on that person. That's scary.
Yeah.
That is scary.
Yes.
It's okay to ask questions. And look, and before we go, I wanted to talk to our patients out there, to everybody who's watching this. I've heard Supreme Dental is not for everyone. I've heard that many times. If you don't want to do your research, if accreditations is not for you, you don't really care. You think everybody's the same. If a clinic that's not transparent is what you're looking for, just to save a couple bucks, you're willing to put all your investment in jeopardy, then we're not for you. We're only for the ones that actually want to get their smile back, that actually want to put trust on doctors that have been worldwide in worldwide trainings, and we only want to help the people that really value all the affiliations, accreditations that we have and all the hard work, because when you're here, it's all about you. Mm-hmm. Maybe you wait a little bit longer in reception, but when you get in that chair, Dr. Luis or any of our doctors is going to make sure that you're well taken care of. And no matter what happens to you when you're in that chair, whatever complication, a crown didn't fit, an implant we have to change, we are going to make sure that you leave with a smile. Yeah. So we will put your mind at ease that we will do whatever it takes to change that for you. So if you want all that, we are for you. All right. Thank you so much for being here today.
Thank you.
Any shout outs you guys want to say before we leave?
Oh yeah. Well, remember, we are doing beautiful treatments, but beautiful experience. That beautiful experience and beautiful treatment, I am very happy with that.
Okay.
Is the most important for us.
Yeah, that's a good takeaway. That was definitely a good takeaway. Shout out to my children, my kids, my husband, and just everybody out there that has put their trust in Supreme and has chosen to do this journey with me, and our other patient coordinators. We really appreciate that, and we truly, really love that for you guys.
This is a medical business, and when the business part takes over the medical, it just becomes a business. You don't want to go to a place like that. But thank you so much for being here at Supreme Dental Podcast Studio, powered by Supreme Dental. And just like these guys, keep on smiling. Thank you.
Trying to teach, talking health, talking teeth. Supreme Dental, Supreme Dental, Supreme Dental. This the podcast.